So good evening, everybody. Thank you so much for inviting me tonight. I'm Megan Avalone, the health officer for the City of Summit, and I work for the Westfield Regional Health Department. We provide shared services in the forms of a health agreement to the city. So tonight, I'm here to talk about probably not an uplifting topic as the last two, but COVID-19, novel coronavirus, what the city should know and what residents should know. We're getting a lot of information, and it's pretty scary. So I certainly understand why residents are concerned. So I'm hoping that tonight, in talking to the governing body and to the residents, we can help have residents have a better understanding of what it is exactly the health department is doing to be prepared. And I hope that they would feel assured that we are certainly prepared if things take a turn for the worse. So. First, I want to talk about putting COVID-19 into perspective. There's been a lot of news outlets reporting on it and a lot of information that seems pretty scary. But I want to, talk about the actual risk and what we see every year. So, for example, in the 2018-2019 flu season, last flu season, we had over 35 million cases in the U.S. About 491,000 individuals who were hospitalized, and 34,200 deaths. Every year, flu season varies. It can be very unpredictable. Healthy people can become very, very sick with the flu, but usually there's little concern. People say, oh, it's just the flu. Sometimes we really have to remind people over and over and over again to get a flu shot. COVID-19, certainly the numbers are much lower. The good news is because we're used to preparing for flu every year. We're used to preparing for communicable disease outbreaks like COVID-19. In 2009, 2010, we had the H1N1 pandemic. Many of you, I'm sure, remember. And the good news is that's still fresh in our mind. We know how to respond. Even if we have to run mass vaccination clinics, we know how to do that quickly. We know how to assemble a workforce, and we know really how to mobilize and get it done. Some of the things that the health department is doing is we're referring back to our pandemic plans. I've been in constant contact with the schools, with Summit's long-term care centers, your subacute centers, your urgent care centers, obviously Overlook Hospital, and myself have a wonderful relationship, and private care providers. Also, we've been getting calls from residents, questions about, should I travel? Are certain activities safe? So we've been able to answer them as they come in. So how do coronaviruses spread? Well, through the air, by coughs and sneezing, by touching an object that the virus lives on, and then touching your eyes, nose, and mouth, close contact with those who are sick, and certainly if you're a healthcare worker, you need protective gear to help make sure that you do not contract the virus. So how can we prevent the spread? So the good news is we're talking about really basic common sense measures here that are really impactful. We're talking about covering your cough and sneezes with a tissue or sleeve, not your hands. So I've taken to call it the Dracula cough and sneeze, because you just kind of go, right? So we want to do things like that. We want to wash your hands often or use hand sanitizer when soap and water is not available. If you do have hand sanitizer, it's perfectly acceptable. You want to make sure that it contains at least 60% alcohol. Very important, we want individuals to stay home when sick and keep their children home when they're sick. What we've been saying is if you're on the fence, if you don't really know if you should stay home or not, you should stay home. If you're on the fence, should I have my children go to school or stay home? They should stay home. And of course, avoid others who appear to be sick or who you know are sick. One of the most common questions we've been getting is, should I wear a mask? So the CDC does not recommend routine use of masks for the general public. The data coming in shows they're not very effective, and more importantly, we may need those masks for healthcare providers who are in direct contact with individuals who are sick. What if I'm planning to travel to an affected area? So the CDC website has posted travel restrictions. We're advising all residents who are concerned about travel to check that website. Right now, we're also saying you should avoid all non-essential all non-essential travel to areas specified by the CDC. But if you must travel, avoid contact with sick people, avoid animals, and again, wash your hands often. If you recently traveled to an affected area and feel sick, we're telling residents that you should seek medical care right away. You should stay home, cover coughs and sneezes, and again, wash your hands commonly. But before seeking medical care, you should call your medical provider to let them know what's going on and not just show up. We're also reminding residents that calling 911 should really be reserved for a life-threatening emergency. If you have a cough and a fever, but you can still breathe okay, you probably don't need to call 911. Also showing up at the local hospital. If you really need hospital emergency room care, absolutely go. But if you can be managed by your private care provider, that's preferable. And if I think I'm sick, what should I do? So I want to remind the residents that we are still right in the middle of flu season. So we're still seeing lots of cases of flu pop up, and it looks like coronavirus. So sometimes residents might have a cough and a fever, and they're immediately concerned that it's COVID-19. But chances are it's probably flu. So we're asking residents to practice good respiratory hygiene, wash hands frequently and correctly, soap and water, use a paper towel, and then use that paper towel to turn off the faucet. You want to wash for 20 seconds or the happy birthday song twice. Use hand sanitizer, that's at least 60% alcohol. Do not touch your face. Stay home if you're sick. And again, if you think you've been exposed to COVID-19 or if you think you may have COVID-19, please call your medical provider before you go. One of the big things that we've been trying to inform residents about is where can residents get factual information? There's a lot of information from many, many different sources, social media news feeds, rumors that you may hear from a friend or from a neighbor. So I really want to remind all residents, it's important to stay up to date with current information, but it's important to try to ensure that information is factual. So we've been referring residents back to 3 really wonderful websites. The CDC has a website specific for coronavirus, has great information, a lot of information. You probably can't even read it all in a day, and it's updated really hourly. NJ.gov, the Health Department website, they have very New Jersey specific information on coronavirus, which has been wonderful. And the Westfield Regional Health Department, we have a coronavirus page, and I know the City of Summit has information on their website as well. There's also a call center. So the number is 1-800-222-1222. It's 24/7 for the public if you have general questions about COVID-19. And there are callers, or there are people to take calls in multiple languages. So if you have a general question that doesn't need to be answered by a medical provider, please, the call center has been wonderful in providing information to the public as well. So any specific questions I may be able to answer?
Does anyone have anything? Yes, Susan.
So first of all, I just want to thank you, Megan, for being so ahead of this, for really being a great resource to our mayor, to our safety committee. You have really been an excellent resource. And I know the #1 thing you've put into my head that I want to just reiterate is we really need to be educated about this, because you've been through this before, and the city has done a good job at having a plan in place. And the one thing that I wanted to ask you about, the weather. There is some talk about when it's warm, we won't be having to worry about that, but I'm not so sure. Can you speak to that?
I can. So the short answer is we just don't know. There's lots of possibilities. When spring comes, when the weather gets warmer, people are more outside, it's quite possible that this will die down and hopefully we'll never see it again. It's also possible that we'll continue to see activity throughout the spring and summer. But what's also likely is we'll see a decrease in cases over the spring and summer, and it will ramp back up again in the fall. In fact, that's exactly what happened during H1N1. During the spring, we had some cases. We didn't really see as many cases during the warmer months, and then as soon as September hit, we started to see an increase in cases. it's really impossible to say which direction it will go in, but I think it's important that residents, even throughout the summer, that we really want to take these messages to heart. So even throughout the summer, you still want to be washing your hands as often as possible, using hand sanitizer, and staying home if you're sick.
Thank you. And I bring that up also because a term I hadn't heard before, the social distancing, that we need to make sure our schools are ready, as we've heard happening in other districts, to have education happen online, and also some of our events. And so in the summertime, there's a lot of things happening. How do you think we'll be advised about what we should be thinking about canceling, and is that coming from the state?
You know, I think it's a case-by-case situation. Right now, it's impossible for me or anybody to say what the situation's going to look like in May, in June, and July. I can tell you that I've been in regular and frequent contact with the mayor, with the administrator, and I'm certainly available at all times to the schools, or if anybody has a concern. I think for, activities, I think we should consider each specific scenario one at a time. At this time, there's so many unknowns that I don't necessarily know that we can say, we can develop a whole plan moving forward from months from now.
Yes, Nora.
Thank you. Thank you, Megan. I can attest, we've been in constant contact, so I appreciate it. I won't speak to it because it's not our jurisdiction, the schools, but I do know that the schools have been working hard to have a plan in place in the event they need it. And, thus far, no, they don't, but, they're ready. The other thing I wanted to point out is you mentioned last week when we did that panel discussion that one of the important things is people who, if they think they're ill, when they talk to their caregiver, they need to be very honest about where they've been, who they've talked to, were they in New York City traveling, and were they with someone while they were in the city having dinner who had said he knew someone who had corona. So that's really, really important that we be honest about where we've been and how we feel. What are our symptoms, not to try to say, oh, I'll be fine, I'll be fine. So.
Absolutely. When you're calling your healthcare provider, I don't think there's any such thing as sharing too much information. And you really want to pay attention to how your body feels. If you regularly travel into Manhattan or take mass transportation and you have maybe a slight fever and a sore throat, you want to pay attention to that. So we're asking all residents to be really hyper alert to how their own body is feeling.
Thank you.
Beth?
Thank you. Thank you again for all you're doing, and we've all been in contact with you. So I'm sure and we're not your only town, so I really appreciate all your efforts. I have a question about our older population. I've seen, obviously, most of us have family members who fall into that category, and I've been watching the guidelines, and there have been different guidelines for older Americans that they start doing some social distancing, stocking up on food. Do you have any specific advice for us? We do have some senior centers in town. We have SAGE, we have the Housing Authority, we have a senior center. So do you have any specific recommendations about how both the city and residents should be looking at these guidelines in terms of being an older population?
Yeah, so we have already started planning, like I said, with the long-term care facilities. We've been in touch with the other senior facilities, and we're going to probably start to have something specific with SAGE. But CDC is now recommending that older adults try to stay home as much as possible. This is still a pretty new scenario, but what we're seeing really shows that older adults are disproportionately affected by this virus, and that's certainly concerning. So what we're saying is if you don't have to go out to public places, you might want to not go out to public places. If you have to, you certainly want to wash your hands frequently, not touch your face, and really try to do that social distancing that we talked about earlier, staying 6 feet away from others if you possibly can.
Okay. David?
Megan, thank you again. You had mentioned that there's so many cases of flu every year, and now there's COVID-19. Is there something as far as a person's symptoms that are different between the flu and COVID-19. So if a person is thinking they have the flu, it may be COVID-19, or alternatively, they think they have COVID-19, they have the flu.
Yeah, at this point, not really. Any type of these types of respiratory illnesses, the problem is they all look alike, and they all look like the flu. And usually they're all spreading during flu season, so it's really, really hard to tell without a test what is what. We have been paying really close attention to travel history, and we've been really paying attention to contacts, but that's probably going to change in the near future. So that's why we're asking anybody who feels as though they may have symptoms compatible with COVID-19, which is fever and cough, to call their healthcare provider for more clinical one-to-one guidance.
Thank you.
Okay, any other questions from council? Any questions from the public? Yes, come on up. Yes.
Eileen Kelly, 47 Woodland Avenue. I just had a question around what, if any, number of residents locally are quarantined that we know of, or if there's anything to share on a local basis regarding COVID.
I don't have my list in front of me, so I don't want to misspeak. If there, certainly not, if any, not dozens. But generally speaking, here's what we're doing currently. Anybody returning from mainland China, Italy, South Korea, or Iran is put on a mandatory 2-week quarantine. We're getting those manifests from the airlines, so we're following up. The health department is following up with those individuals. It doesn't necessarily mean at all that the person is sick or that the person is going to become sick. It's really at an overabundance of caution that we're saying you need to be separated for the 2-week incubation period. Also, anybody that's been in contact with somebody that is tested positive, we are quarantining. And this is something that we're doing throughout the country, not specific to Summit. But the idea is we really want to stop that chain of infection before it has a chance to spread. So, and I can tell you, across the state, across the country, public health is working hard behind the scenes to make sure individuals who should be quarantined are absolutely quarantined.
Okay. Thank you so much. This has been very informative. We
Oh.
really, oh, go ahead.
And if I may, just one last thing. I really just want to remind residents that truly at this point, I think we can still stay calm. I feel confident that our response is going to be fine. All the city agencies have been preparing really, really well. And I think that the best thing we can do, it sounds so simple, but again, just wash your hands, stay home if you're sick, don't touch your face, and call your healthcare provider with any questions.
Thank you so much.
Thank you.
Thank you, Megan.
Thank you, Megan. Do you know how hard it is not to touch your face?
Yes.
Very hard.
Very hard.
It's so hard.